Dear viewers, this is a special interview with Dr. Anantharaman, and this is going to be about the medical field and particularly about what kind of research has been going on and how the field is developing on its own, and also with any thrust from the government or with any demand that is there to make the medical care field better. And he's also specialized in diabetic care and endocrinologist and internal medicine specialist. So welcome to the show.
Thanks for having me here.
So you are more interested in being a specialist doctor than practicing in any corporate hospital and just making money.
I wouldn't say, there are different options. Yeah. So I chose to do this, and I've been doing this for the last, say, 10 years. 10 years I've had my own office, and I practice out of my office, which is called Magna Centers. So that's the name of our center. So I work out of that. I also work at Chinmaya Mission Hospital, which is again a hospital. It's run by a Chinmaya Mission Trust. And in addition, I do visit a couple of corporate hospitals. I visit Cloud9 and Motherhood. I wouldn't say exactly that I don't work for corporates, but I do work mainly at my own office.
But you don't seem to be enamored by the corporate setup. It's also not because you're against it, but because you feel that that perhaps is not your calling, because here you can do it your own way and you also have your set of patients. And because you're more research oriented and you're more like a scholar in medicine, that you try to study medicine and not just administer medication. What do you feel?
No, I wouldn't look at it in absolutes. So, whenever we take a path, sometimes, the path helps us. Sometimes, it works out in your favor, actually. So I was actually, I started my career after finishing my DM in endocrinology. I started working in a medical college. I was working in St. John's Medical College Hospital. For 2-3 years, I was a medical teacher. We were teaching postgraduates. I've trained 1 or 2 batches of DM endocrinology postgraduates. Then post that, I started Magna along with my friends. That's also there, actually. So Magna was started with my friends who are in Hyderabad and in Chennai. And we started this, actually. So we wanted, to give a different flavor to the patient. And in fact, as far as endocrinology is concerned, it is more a preventive field. So we don't want the patient to get admitted to the hospital, and we want to provide better outcomes to the patient. So this does not require actually a hospital setup, actually. So, but very often what happens is that when a doctor comes newly into practice, so there are not many options for the doctor to go and practice at, basically. So all the patients go to the hospital. So the easiest way one would step into start seeing patients is to actually visit a corporate hospital. I was also associated with several corporate hospitals. So, and my experience with corporate hospitals have actually been positive. So they have not been negative. So typically they don't, when I first joined private practice, they said that, corporate hospitals will put pressure on you for numbers and all that. But my actual lived experience is actually contrary to that. So when it comes to endocrinologists per se, corporate hospitals are not really bothered about what we do. They actually give us space and then this thing. But the thing is, when the same thing can be done by yourself, you have a little bit more freedom. And you can also assemble better care for patients. So in my center, in Magna, what we do is we have a dietitian, we have a diabetes educator, so, and we have 4 nurses. We have got a big team, actually, so which take care of patients, actually. So this is what I'm supposed to do. And there are some of my patients who've been following up with me for more than 10 years. So I'm able to actually give continued care to them and maintain that care. Because I have my own setup. So owning my own practice has really helped me deliver better care to patients, I would say.
But there is this expectation in the minds of patients and also people who seek healthcare that the medical field is an absolute field in the sense, there are no, errors, or there is no scope for misjudgment, or there is no scope for imperfection and things like that. In the sense, they expect you to know it all and do it all because you're doctors and you've studied it. And many doctors also have this attitude in making people think that they have the answers to every question about medical care. But only when a patient is dying, that's when they say, oh, it's God and it's your luck and, your time has run out and things like that. So this leads to a little bit mistrust in the process, because people think, okay, once you behave like you know the answers to every question, and then ultimately you say that, no, it's not working, we tried. So if you're just trying, even an Ayurvedic specialist also could be trying, even a homeopath also could be trying, even somebody praying for you in a hospital, in a temple also could be trying. Okay, so what did you try so much and also getting me to spend so much money? So is there a real problem actually in the medical field that you should not actually be projecting it as an absolute science, like, I know the answers, because, like some of the senior doctors...
I couldn't agree with you more than this
Some
thing.
senior
You have
doctors
actually hit the nail on the head. So basically, when it comes to, you take, for example, the recent interventions. See, for example, let us take a small thing which everybody understands. Let us look at, vaccines for COVID as a intervention. Okay. So when you look at vaccines for COVID as an intervention, so the benefit is different to different people. Okay. So I would say that modern medicine is like a kitchen knife, basically. You should cut the vegetable without cutting the finger. Okay. So how you apply it and how you understand and do the things is very, very important, actually. So the FDA and the American Association of Pediatrics has gone so far as to say that all children above the age of 4 should get a COVID vaccine. In fact, COVID itself poses a very, very small risk to children. In fact, in our country, nobody, in fact, even in the US and even in India, if you look at the number of children who've been vaccinated for COVID, it's a very small number, because commonsensically people know that it's not required. But who it is required for is people over the age of 45, where the immunity comes down. Where you give the vaccine, there is a benefit. Okay. So every intervention has got a certain benefit, and the benefit is understood through evidence, actually. So, there is something called evidence-based medicine, which we all practice. So,
and that's why it makes it science.
Yeah, that's why it makes it science. And it also makes it an art, actually. The art is to bring the evidence and discuss with the patient in a way that they understand.
And the discretion also makes all the difference. To be able to know whether you can administer something or not. Even if
what
it is
to
required.
Say to who and when. That's very important.
And what to give to whom, when, and why, and should it be given at all, even though it is necessary.
See, a COVID vaccine is an excellent intervention for mankind. There is no doubt about it. I mean, there is no doubt that the benefits far outweigh the risks, actually, but not in everyone. Like, for example, the mRNA vaccines have been shown to cause myocarditis in young men, actually. But if you look at the benefit, what they get out of it, and if you look at the risk and benefit are very similar, actually. So it's not that, so that means that you don't give it to young men.
But a lot of very senior doctors that I've spoken to, who generally say that, the medical field is not even close to being 50% perfect as it is expected to be, because we are still so far away from even understanding the human body. And still, people have an understanding that the doctors know it all. Because when specialists themselves, in the sense people have been doing research saying that, no, we don't know the human body. We don't know. Like, for instance, you give paracetamol, and the paracetamol goes all around the body, but only a little goes to that particular part where actually it needs to work. The doctors or the medical field still does not know how to send it directly there, correct or not?
That's correct.
And to get it to work. And it's going all over and doing so much damage also elsewhere, perhaps at the same time working to a certain part. And if you still don't know how to work with the body and to be able to have some kind of ownership to say that, no, I know what I'm giving. Because, when you go to a corporate hospital, one of the biggest problems is that every specialist who comes to you thinks that he has found some, reason for your ailment. Because perhaps that he has to say that, or that way everything has to be seen holistically, that everything is related to everything else in the human body.
There are two reasons why this disconnect is happening. One is because doctors on the whole are not trained to communicate uncertainty to the patient. Actually, okay, so they all tell the patient that you'll get better. Either you'll get better or you'll do good, or this is harmful for you. Like for example, a young patient will come to me with a say TSH of 7, and they will tell that I don't want to take any medication. I tell it's okay, you don't take the medication. Okay, because the risk associated with not taking the medication is not something very serious actually. So we need to understand their perceptions from their angle basically. So unless we understand their perception, the patient's risk perspective, and each person is different actually. Somebody, we need to look at the patient, we need to talk to the patient, we need to understand their values and preferences by talking to them. And that can probably, it comes with a little bit of skill. I mean, probably, it'll take about a few years for a doctor after starting practice to pick it up. So very often what happens is when you go to a corporate hospital or a private hospital, not all doctors will have the same kind of experience. Some will have 5 years experience, some will have 10 years, some will have 20 years. You need to normalize the doctor's behavior for their experience also. So that is also there.
First of all, to be able to treat somebody, you need to know that fundamental fact that you can't actually heal anybody, and the body has to cooperate with you. And if it's different from another. And in a case like that, do you think that to be able to generalize medicine, like for somebody,
No, we should not put it on a pedestal.
somebody, even a threshold of pain is so different from for a single person compared to another person, could be in the same family also. So to be able, for somebody, it could just be like, I know my grandmother used to take a crocin, and that could cure her literally for everything that could be a problem in her. But for people nowadays, even if you take about $5 also in a day, they could still be having the problem. So sometimes people thought a crocin is like the be-all and end-all of medication for you. But now that, only if you go to a specialist, first of all, you know that you can't go to a less qualified doctor, not a doctor in a smaller area. The doctor should be well qualified, well known, a star kind of a person with presence on YouTube, TV, has been seen in the newspapers. So, do you think that it's like you said? Could it be that it's becoming more of an art and less of a science? Also, because there is very little research that's happening, and particularly in a country like India, where we are genetically different from perhaps the Westerners, and a lot of these medicines have been developed there, and maybe their threshold, their tolerance, their food, their culture, their genes are so different from us. Perhaps that we should start looking at medicine very specifically.
That's true. In a way, I would say that there has to be more research done in India. Because like you said, there is no data coming out of Indian patients actually. So if you look at the whole of India's population itself is 1.5 billion. So if you look at the entire white population or the Western population of the world, Caucasians or whites basically, not Hispanic population, that is 300 million plus 800 million, that is about 1.2 billion. They are actually lesser in number than Pakistanis, Bangladeshis and Indians put together. So ethnically we may be diverse, and even within this 1.4 billion population there are subgroups. So you know for sure that Punjabis are totally different from Keralites actually. So appearance and this thing wise.
For example,
so there
even
could
with the
be
skin also. In the sense, the Western skin ages faster, Indian skin. You can't apply the same, depigmentation that you're giving to a Westerner or skin care. basically the collagen, like, how they lose it so faster than most of the Indians, like even at 80, some of them may not even have wrinkles at all. So you are like, everything, I'm not saying it's wrong. It's only because we are not doing enough work.
No, no. There are many reasons why research is not being done in our country. I'll come to that second. First, I'll address your question whether we can use the medicines that we are using, which has been developed in among Westerners, basically. So, one thing is that, see, over the last 20, 30 years, so we use a tool called a RCT, a randomized control trial, to look at whether medications are effective or not. Like for example, take the simple usage of a streptokinase for treating myocardial infarction. So if you get a heart attack, so if you go to the hospital, they will give you something called a clot buster. So the clot buster is given, and and then you randomize patients. So this was done in the early 1980s actually. So you go in with a heart attack. So to one group you give streptokinase, to the other you don't give anything, or you give a placebo infusion, which looks like streptokinase. So, and you look at what is the mortality. You look at only hard outcomes. You look at only mortality. You look at how many days the patient stayed in the hospital. But looking at the intervention, this is called randomization. So through randomization, we can understand what is the effect of streptokinase on the population. But even in those RCTs, invariably, even studies done in the US, studies done in the UK, etc., also include South Asian populations, because there are South Asians in the UK, US, Europe, everywhere. So almost all RCTs are done in multi-ethnic populations. So if you want to look at whether the intervention will work in South Asians, what we do is we take all the RCTs, take out only the South Asian population, look at whether these two, whether the effect is the same. So they divide the effect based on various characteristics. So the effect, like I said, for this, when you look at COVID vaccines, it's very effective for 80-year-old and probably not that effective for a 15-year-old. So this we know by doing the RCT. So we can solve that through that method actually, because this same question, because medications are very difficult to invent. It's not easy to invent a medication, because any intervention or medication is extremely expensive to innovate.
And literally requires that kind of hard work, dedication.
Yeah. And you need to have a full this thing. So that is required. So, and what is important, like the other point that you brought out, that we are not doing any research in our country. So, see, there may be many of the risks, maybe the benefits are very clear to discern from RCTs actually, but risks are not so easy to discern. Like for example, like you said, when we give the drug to maybe 1,000 patients, you cannot make out that it's producing a side effect. When you give it to 1 lakh, you may not be able to discern that there is a side effect. But when you start giving it to 1 crore people, 1 or 2 may get a problem.
Bad
actually.
too.
Yeah. So that it may be a bad thing actually. So, but even then, that the problem is occurring only in 1 lakh or 1 crore prescriptions. So, but even for that, there is no research happening in our country. That is for sure, because clinical research itself is a full-time occupation. It's not.
Could it also be because of too much reliance on science? Because science actually tries to generalize, in the sense, if it works for one human being, it should be able to work for every other human being too. Because science doesn't look at different human beings as different people. It basically says ultimately could be about a little bit of genetic difference, which is just about 1%, 2%, and things like that.
In fact, we are all genetically much more common.
Yeah.
So when you look at whites,
so there could be something else that the science is actually missing in terms of this itself, because to be able to say that this person is different from another person, like you said, it could be happening. The adverse result may be coming with about 2 to 3 people, or maybe just 1% in 1 crore people. That's been missed in 99 lakh people.
But even then, we know the trade-off.
That even those 3 people could belong to one family, one race. You got it. So that. But let me tell you, that way, don't you think COVID should have taught so much to the medical field?
Yeah, it has taught a lot.
Because, like I've seen my neighbor who died, an elderly lady, she never went out and she did not even open her windows. And she stayed inside, she was fed inside, and everybody else was going everywhere. They did not get any COVID, nothing, and she died of COVID. Okay. At the same time, in another house, there was a son who was actually vulnerable because he could go out and he could get the disease, but the mother, who was actually quite unwell, she did not get it. Living in the same house. So, I mean, I think this should actually open the eyes to a very great extent to see that how the body works. Is it the mind? Is it psychosomatic?
See, the a knowledge of science and knowledge of prognosis will not help us in deciding the absolute. See, I do have a lot of patients who had a heart attack, who had an angioplasty, who had a bypass surgery, who still continue to smoke and drink. Actually, okay, they are continuing to be alive.
I've
And
seen people
this
who
thing.
smoke even 2 packets a day at 85, having
Yeah.
died a normal
Yeah,
death,
yeah.
and people who
So,
just have smoked a
yeah.
few cigarettes a day dying at 52 or something like that.
So basically,
Why do doctors say all kinds of things
no, it's not like that. It is the
literally
risk is higher.
spoiling the
So
happiness,
it is a
peace,
perception. It
and
is the absolute risk. So let me come to that. So if you take, say, 30 people, 130-year-old people, and all of them smoke, and you follow them up for 20 years, and if you take 30-year-old people, all of them don't smoke, and follow them up for 30 years, these kind of studies have been done plenty. We know for sure that the event rates are definitely much more in those who smoke than those who don't smoke,
but
actually.
that could happen with anything, even like driving a
Yeah,
car.
that's good. Yeah, yeah.
I
So
mean, you
risk
could be a
could be,
perfect driver
that's
and
what.
somebody else could come and hit you and kill you. So but why, there is also this theory that, it's all the mental state. Like if you're positive, if you think there is nothing wrong, if you actually boost your immunity by the brain telling the body that, like you can fight it, or you actually are more sensitive. You make yourself vulnerable because, there are people who can catch a cold by just drinking a glass of, not even like, ice cold water, just normal cold water. In the sense, because they've already prepared to get, unwell. You understand? Like, they go out
No,
in
there
the
are a lot of unmeasured
cold
factors.
weather.
Yeah.
There could, I'm saying that, still to understand, like now at least people have started understanding that there is some role of yoga and meditation and all on good health, which was denied by many doctors for a very long time. And now doctors themselves actually have gone to the extent of saying that you can do some meditation and cool your mind and, calm your body and do some more
definitely.
yoga. There is something in that and things like that, which like they used to outrightly, with perhaps the Christian, what do you say, ideology outlook in the beginning, maybe thinking that the Eastern, these practices were not right or something like that. But now I think yoga has found more, currency in the Western world than perhaps in India, must be
Any
because
form of
everybody goes.
exercise is beneficial. Yoga has been shown to have clear cut. Even there are RCTs done in India which have shown benefit for reducing depression. For example, there is something called Sudarshan Kriya. I think Art of Living teaches Sudarshan Kriya a lot, actually. So Sudarshan Kriya has been specifically looked at to see whether it will reduce depression scores. It's basically a breathing exercise. So that has been shown to reduce depression scores. So these are all well proven by science.
But a lot of doctors for a very long time, because even when I used to talk to doctors maybe about 15, 20 years ago, they used to say the body knows how much to breathe. Because the body knows that how much oxygen is required. But the same doctors now are saying that you need to deep breathe, you need to actually be calm, you need to regulate your breathing. And then some said, when we were young, one particular doctor saying that when we were young, when we were studying in college, that was in the 1960s or whatever, we used to not only separate the yolk from the white of the egg, but used to also wash the white, so that we used to be so particular, not even there would be a stain of the yellow on, and then we would eat. But now we say it's not the yellow, that's actually killing you. But they themselves are actually surprised. Like Dr.
because-
B.M. who was teaching medicine, who was telling all that to his, doctor students, today is talking exactly the opposite. This is happening with a lot of these doctors. But that means what kind of an idea should people have? And that's why perhaps like you've been treating diabetes for such a long time, but at the same time you see doctors sitting and telling, insulin is not doing good for you. You should not be on medication. This is not what it is. And what happens? But at the same time, I have somebody like you in front of me where I've seen remarkable progress that patients have seen by coming to a person like you.
No, that's no, no. See, when
So
it
is
comes
it
to
science or is it only Dr. Anantharaman?
no, no, no,
No, could
no, no,
be, could be.
no, no. It's
Because
not
like,
like
they've
that.
gone everywhere. It's the same insulin, it's the same Rhizodec Fiasp or what do you
No, no,
say?
it's not that. See, basically, what happens is whenever a patient comes to us, so we set the expectation of what to expect out of the treatment actually. So we cannot say that, it will cure all your problems. So I will tell the patient that there is no treatment for this. So doctors should be forthcoming to say that there is no treatment for a particular condition. So we don't need to sell snake oil or false hope actually. That
What
people
if, in
accept the
spite of
fact
you
that there is
telling
no
that the
treatment.
patient recovers?
In fact, in our Eastern philosophy, we accept things as they are. Like,
No,
for
no,
example, if
what?
you took a look at white people, they are very resistant to death, actually. So, I mean, so death is not something that they accept easily. So, when you look at the coverage around COVID, so many people dying. In fact, majority of the people are above the age of 85, actually. So, Indian patients in general, because of our philosophy and all that, we accept death. I mean, it's
It's
inevitable,
not
of
true
course.
anymore because people are having so much wealth. They
Yeah.
think that they can buy health. You understand?
So, no, no, they do accept because there is a philosophical
But don't you think
this
there's too
thing.
much pressure on doctors also to make somebody all right? Doctor, can you do something?
No, no,
Or
no.
can I go abroad?
No, we can give
Can
all the options that work, but I'm against giving options that may not work,
But
or
how is
they
it
are
possible
completely
for some
experimental.
people the medication actually works?
That's
Some wealthy
variability.
people
Yeah.
live longer these days because, I think they get the best food and the best medication.
Yeah, yeah. Of
They
course, they have
also,
less stress also. Wealth has been shown to correlate with longevity for a lot of people. If you're wealthy, if you're powerful, you live long. You can see all our politicians are living for a long time, isn't it?
no, for
So they have
instance,
learned leadership, how
no,
to
for instance, like
communicate,
you are
and
talking about medication and things like that. Like, for instance, a simple thing like you think that you had a heart attack and then you go find out that you have a higher troponin. And then now, like I've spoken to a lot of people, like with one instance where I found that, a patient had higher troponin, but no, it's not. Troponin can be because of so many things. Then stress. Okay, everything's done. But still, you could have had a heart event or whatever. But people needn't have known about it. But I think knowing that, you had a higher troponin, echo, there is some problem, you have a valve leakage, you have something else. Don't you think all these tests are actually making more
no, no,
scared of your life?
especially. No, I'm glad you brought up this point. So many people are of the impression that more testing is equal to good health. I would say the exact opposite, actually. So we need to do only those tests which have been shown to have a positive outcome. So there is a test called PSA, or a prostatic specific antigen. So a lot of trials have been done to look at whether screening somebody for PSA. Like, for example, somebody is 60 years of age, your doctor may say you get a PSA done to
Because
check
you're
whether
60.
because you're 60 years. So it's a screening test to detect cancer. Okay. So invariably what happens is even if you detect that the PSA is high, so there is probably no good treatment option for that, or whatever treatment options are there, it's not going to help you as much as you just leave it alone, actually. So there have been instances where you actually follow up the patient without giving any treatment. There have been studies in which PSA was high, patient has not been treated for 10 years. He did as well as the patient who got treatment on day one, actually. So any intervention that you do should result in a longer lifespan or a better quality of life.
How
These
is
are the
it?
two
But how
outcomes.
is it this that one particular patient, an elderly person, treated for CLL, chronic lymphocytic leukemia, and that was quite bad. And the prognosis was that okay, maybe for about 2-3 years or whatever, thing. Then it goes into remission. It comes back. Then once again it disappears. So that is nothing. Not they could not even afford medication after that. But fortunately, they just went away. So, I mean, now actually, whether there was anything like that at all, kind of, this is a big question. In the sense, there you have seen also, perhaps, there are some of these things
Yeah, yeah, yeah.
sometimes just disappear,
Yeah,
and
yeah.
there is no explanation
No,
to
we
it.
have seen, there is a patient with, when I was doing my residency, patient with acute myeloid leukemia. We never thought that the patient will make it, actually, because we were treated the patient in a government hospital with no facilities, with hardly any this thing. We gave the chemotherapy and the patient got better. She went into remission, and 1 year later she is lo and behold doing fine, actually. Complete remission. The success rate of that therapy was supposed to be 5%. But, she was in the lucky 5% actually. So, like this variation is extremely common
But
in
is it to do
humankind.
with luck? Is there something called luck, or is it some
There's
some
definitely-
some quirk of fate, or is it like maybe misdiagnosis to an extent?
No, some
or,
of it can be, some of
or
it.
you could just say it is like an aberration.
I would not say an aberration. So many things can be explained by science, but the science you need to understand is not exact actually. So there are no absolutes in science. The moment you say that the science is set, that means that that itself is an unscientific
No,
statement.
to speak about you, you're someone I've understood that you try to understand the medicine, you try to understand the disease, you try to understand the patient, you try to understand the background, and you also spend a lot of time talking to people. I think that's extremely important. I remember my mother going to a pulmonologist, and the pulmonologist did not touch her. And she came back and she said she would not go to him because she said, how would he know that I'm not feeling well if he didn't even touch me? You got it? Because like the traditional understanding, the doctor has to touch and feel you.
Yeah.
Okay, so to be able to, for him to know, like how can somebody sit far away and just look at your X-ray or something and say that is that you're unwell? And I've seen people till 94, 95 not having even diabetes, hypertension, nothing. So, do you feel now that it is not just medicine, it is also the doctor?
It's it's definitely definitely a doctor also. The doctor will make the difference actually.
But you're not taught. 90% of the doctors are not even taught communication. Isn't it very sad?
It's actually no. What I feel is there cannot be a modular approach
There
to
should be,
communication.
because the
so
thing
if there
is
is a modular approach, see, if there's a modular approach, you can improve the average, but you cannot this thing. So over a period of
So don't you think
time,
it should
the
be part of
experience,
it should be
it's
part of your medical education
100%,
that
100%.
you should be taught how to speak to
In fact,
the elderly?
if you are on YouTube now, you can actually go to a interview by a gentleman who's the founder of Sun Microsystems. His name is he's from IIT. He, after finishing IIT, he went to the US, and he has started one of the earliest software companies in this thing. So he talks about doctors, and with the advent of AI, he says that in 100 years, all your doctors will be actors. They don't need to know any medicine actually. So I mean, there's no need with the advent of artificial general
The
intelligence.
diagnosis will be
you
done
must
by
be
AI.
somebody who has got the ability to communicate with you.
Better.
Yeah, communicate with you properly with empathy, understand what the other person requires. Like, for example, a 15-year-old has totally different set of anxieties and needs than a 75-year-old.
But I've also seen that, doctors, even if qualified equally, but they're very different from one
they're
another.
very different. They're very, very different.
And sometimes some of them have only the bad news for you. Some of them have only the good news for you. Some of them have only the mixed news for you. Some of them only look confused all the time. You got it? So only it depends on how lucky you are. In the sense, if you end up with a wrong doctor, even like you're not dying, but he'll make you feel like, okay, you are totally wrong about yourself. Like this whole story about, the doctor goes to a patient who is unconscious or something, and he's sleeping, and he goes and says, okay, nurse, this patient is dead. And this patient hears it and he sits up and says, but I'm not dead. And the nurse says, stupid, just lie down. Do you know more than the doctor? You understand?
Yeah, I
it's
understand.
like that. The doctor knows it all. You got
The doctor
it?
knows
Even
everything.
if I'm feeling perfectly all right, you got it? This happened with my mother. Like, at one point, like the doctor said, this is wrong, this is wrong, this is, but I'm feeling nothing wrong. You got it? But why are people behaving like this? You got it?
Yeah.
Like the doctor said, there's something wrong with you.
Who said that? Who is this quote attributed to? The common sense is the most uncommon thing in the world. No?
That's very true.
So, because see, when it comes to medicine, we need to actually practice with a lot of common sense. Okay, So basically what we are saying that we need to teach is basically common sense. Okay. It's actually analytics. So people can be taught how to be civil, for example, you can teach a waiter how to come and say, hi, how are you, and place this thing. But this requires analysis actually. So basically you need to analyze the situation and react to it. So that invariably takes time, I believe. I think, we should allow the doctors to this thing. But I'm confident that most doctors, after about 5, 6, 7 years of practice, they become better at it, and they become more this thing.
But the younger doctors I see are more like
Better,
astute
more
when
astute.
when it comes to being good communicators. In the
Communicators.
sense. So I wanted to know
the younger
because
generation is definitely
compared to
better.
the older ones, because the younger ones generally have have a smile on the face, have a very tempered language, and even if they are not very good, but they try to be nice to you.
Yeah.
Like some of the older ones I've heard, like some of them walk in the sky. So
No, but medicine has changed a lot in India actually. So what it was 10 years ago is not what it was 20 years ago, and it was not what it was 30 years ago. Every 10 years there is always a change. Clinical practice of medicine, how doctors are behaving towards patients, how and of course we definitely have much more doctors now than
but you
before, even
also
per
work
capita.
under extraordinary pressure because I remember when my mother was unwell and she was in the hospital, so that one day a doctor told me that he was going to call me a little later. He called me at about 12 in the night. He said he just finished and he was going home. I had a long chat. Then I said, "You take care of yourself too. I think you need to have good health too." I said, but then he said, I felt so emotional about it because it's the first time somebody asked me to take care of myself. So he said, generally, like people are only calling me and asking, like, how is my mother? How is my sister? How is my friend? How is somebody else? But nobody ever asked that, how are you feeling? So this could be also, because I think this could also lead to a little bit of indifference because, like for a person, like he or she or in his family, you have very few instances of somebody falling ill. But for a doctor, you see all the time, but after some time you say that, the world is actually very cruel because they are ultimately only expecting themselves to become better, but not bother with the doctor at all. And everybody is waiting to find a fault given any little chance.
The pressure is intense. There's no doubt about it.
Yeah, for
Especially,
you too,
yeah,
like me or anybody calling at any time. For us, it's the biggest thing. For you, perhaps it's the same thing. But that could affect you.
yeah, definitely. So over the years, I've tried to cope with it because most of the things what I do now are done through my associates, basically. Okay, so that's one of the reasons why you asked me the question. No, so why I stepped out of corporate practice was that the corporate practice doesn't allow me to. It's for a selfish reason. Is that it doesn't from the patients is very real. One way to solve this problem will be to have many caregivers who are qualified
To talk.
to talk to the patient. So patient needs
and
a
it's genuine.
good experienced hand actually.
Whether
A
there
good
was
nurse
whether
can do a good nurse who's experienced, who's 40, 45 years old, who's seeing patients for last 10, 15 years, can communicate much better than a junior doctor regarding patients. Like for
like
example, a patient is admitted in ICU. A good nurse can do that, but unfortunately in our country there is no leadership. There's no leadership.
and
So,
people normally don't
yeah,
respect nurses
yeah,
also
nurses.
because they
No,
think
no,
that's a
no, no,
lowly
no,
thing.
no, no, no. That the main reason why the nurses don't have that status is because we have not created that structure.
Unlike
So,
in the
if you go on,
US.
yeah,
I
unlike
was
in
told
the
by one
US,
of the
yeah, yeah,
doctors that you can't
yeah,
function
yeah,
as a doctor in the US at all. And first of all, you have to treat them very well. You should respect them. And you can't run a hospital without the complete
yeah, yeah.
cooperation of
No, that is
nurses.
because the society is short-sighted.
Dignity.
Yeah, dignity of labor. Like for example, if you go to American Diabetes Association conference, you'll see that the diabetes educators are presenting an entire session for half a day actually. So their job is to educate patients. They are not doctors actually. They'll teach the patient how to how to use a glucometer, how to log the blood sugar, everything. There is no dignity of labor in our society. That's also there actually.
Okay.
So that has to improve. That will improve. I think
You
we were.
being an endocrinologist, and then many people don't even understand the field unless they are going to a diabetologist, because it's like diabetologist is something different from an endocrinologist. But that's such an important field actually, and most of the people, when they start getting problems with the endocrine glands, that's when they realize that what a big field it is, and then they literally start understanding the doctor and the field and the secretions and the little organs and all that. But let me tell you, but the diabetes, is it actually as big a problem? Because, now has it become like people who are like short-sighted, long-sighted and all that, and a certain amount of diabetes is acceptable because of the kind of food that you're taking, because of the kind of lifestyle that you lead. And the body can actually manage a certain level of diabetes for some time. Maybe are we being too conservative in trying to understand diabetes like how we would have understood it about 50 years ago?
Let me look at it. Let me just bring a small perspective about diabetes. So, diabetes is a polygenetic condition. So, it's driven through genes. So, if you look at any patient who has diabetes, more often than not, there will be a family history. Either a father, mother, or a brother, sister will have. It's very uncommon to have a type 2 diabetes patient without a family history. So a negative family history is highly protective for diabetes. Like if there is no diabetes patients in your family, it's protective. Okay. But even then you could get because of your bad lifestyle or whatnot. So in that case, if you correct the lifestyle, the diabetes goes away faster for you than it would for people who have a genetic history. So that way it is genetic. And environment definitely has worsened has increased the onset of diabetes, because what we do, the environment what we have right now is very obesogenic. There is very less physical activity. There is definitely much more junk food. So even if you go as far back as 20 years ago, there were no food ordering apps. There was no excess availability. When it comes to junk food, I would say that all the darshanis in Bangalore, all the samosa, chai wala on the road, also junk food actually. So it's not just pizza, burger actually. So the general availability of food has become much more, a lot of refined food, and almost all occupations in urban areas. So be it a very rich person or be it a very poor person, it is sedentary. There are very few occupations which require physical labor. So even the farms are all mechanized. There are very few farms which require very lot of physical labor, and hardly anybody does them anymore. And even when it comes to the urban poor, they do only sedentary work. They are either, many of my patients are taxi drivers, auto drivers, uh, and they sit the whole day, especially men. So they cannot get out of the sitting posture. Like I'm sitting now, they have to sit the entire 8 hours and work actually. So it is not only IT employees. So people get the impression that sedentary work means IT people. Not like that. Even drivers and auto drivers and taxi drivers are also having a sedentary employment. So this has definitely driven the rise in diabetes. Like what you're saying, that we need to look at it. So when somebody gets diabetes at a young age, they should take it very, very seriously. They should take it very, very seriously, because um, diabetes causes prognosis to worsen actually. So if you get diabetes when you're in your late 20s or early 30s, that's the early onset diabetes. So you need to take it very seriously. In India, many people at the age of 45 have diabetes. So if you have diabetes, you should take it seriously then also. But over the age of 65, 70, whatever diabetes happens, it's more of a age-related condition with the obesogenic tide that is there. The tide lifts everything actually. So if like in a new moon day, the tide comes in and lifts all the boats, no? So like that, what happens is number of diabetes patients over the age of 65 also increase, because when the grandchild and the son bring junk food home, even the 65-year-olds have it actually. It doesn't go anywhere. It has to be consumed. So if you order processed food at home, everyone has it, even the 65-year-old. So what happens is that and also culture is infectious. So there is a diabetogenic, obesogenic culture also. We don't have the culture of doing physical activity. We don't have the culture of physical infrastructure. Like for example, if you look at Bangalore, there is no physical infrastructure for you to walk. I'm glad that I came for the interview today, so I took some time off. I walked around Jainagar, fourth block. I'm doing that after almost 10 years actually. I'm always inside a cab or something like that. I hardly try to get out. So it was good to actually, it's a very walkable locality, Jainagar 4th block. But how many places are there like Jainagar 4th block in Bangalore? So where people can actually walk around easily.
But
So this is a problem actually. And diabetes, when you are young and you have diabetes, you should take it very seriously. If you're old and you have diabetes, okay, we can manage it easily. I mean, it's not such a big threat.
no, is it that a lot of people start getting treated for diabetes more because they found it out in a lab test and they feel the need to be on medication, not because they have any complications, not because they have any, what do you say, indications or symptoms. And that itself is a wrong thing because perhaps a certain level of diabetes could be managed in the sense the body may be able to manage with. I'm just asking you.
This is a very important question actually because because this is my bread and butter.
As long
No,
as
I
people,
cannot say.
as long as people keep coming
So
to you.
you cannot go to the barber and ask, do I need a haircut? Actually,
Yeah.
so you don't see. You come to the barber. I'll always, and if you ask him, do I need a haircut? He'll definitely say you need a
Do I
haircut.
need a
So
special
you're
haircut?
probably-
Yeah. So,
So this is a very important question. Let me try to answer it with the best in a best scientific possible way. So once you're diagnosed with diabetes, in fact, majority of diabetes patients are actually diagnosed through lab tests alone. So if we wait for symptoms to occur and then diagnose diabetes, it's too late because we'll diagnose diabetes then almost 10 years late. So I'll tell what benefit you get from treatment of a HbA1c value. Okay, so if you have a HbA1c of around 8% and if despite no treatment, if the HbA1c remains high like that over the next 3 to 6 months, definitely it's a problem actually. So
on
if
the
you
kidney.
reduce on the kidney, eye and all that. So if you control your diabetes in such a way that the HbA1c goes down to 7% and below, there are very good evidence that has been shown that your risk of kidney disease, heart attacks, strokes, everything will come down. Okay, so this is science. I mean, there is no doubt about it that there is a benefit for treating asymptomatic detected patients. So, for example, if someone has symptoms even at 7.5%, and they want to get it treated. For example, somebody may have neuropathic pain even at a HbA1c of 7.5. Like you mentioned, symptom thresholds are different. Some people may get a neuropathy even at 7.5 HbA1c. Treating it may improve the neuropathy symptoms over the period of next 6 months to a year. So symptoms definitely we should treat, and any HbA1c above 8 and all, there is no doubt. So the borderline case is very interesting. 6.5 to 7.5, 8 is very interesting. We could give the patient, say maybe 3 months, 6 months, just to do diet and exercise and see whether
But that's not what the doctors do.
no. Now there is a move
See,
to
any
give
way
more
that you take
medication.
consultancy fee, so that I think that you can actually increase the consultancy fee and perhaps tell them, because somebody like you can actually, like one day I remember with a particular patient, you were saying that when the person was not taking care of himself or herself, that you were saying that perhaps if they go around a hospital and watch people being, subject or like undergoing dialysis, that's enough for them to take care of themselves. Correct. So I think education need not be just about you telling them, but
No,
but
they
there
need
is
to
ve-
know. Like,
there
for
is very
example, for a
little-
young person, say for example, whatever question you asked was correct actually. So, and also there is a lot of information floating on the internet and
but there's a
the
lot
social
of
media.
it which
So,
is
for example, you have
negative in the
7%
sense-
HbA1c, and there is people say that you have 7% HbA1c, you don't need to do anything. It's not that you don't need to do anything. You need to do a lot of diet and exercise. Try to bring it down to 6.5 through diet and exercise. Diet and exercise, by mind you, at 7% HbA1c is not walking around your apartment for 15 minutes. It's like jogging for 25 minutes, 30 minutes. doing strength training 3 days a week and cutting down your calories by almost a meal a day. Actually, almost one full meal a day
But
you
if you
should skip.
talk to a diabetologist, it's like you can't have a life at all. Apart from walking and jumping and perhaps, not eating anything at all. Don't you think so? Because, don't eat this, don't eat that. Don't do this, don't do that. And you just need to be walking all the time and jumping and jogging and doing that. And it's better, people would say, I would just live for about 5 years, I would live a better life if he's eating, drinking and doing things. So is there not some other way? And that's also after taking medication in many cases. What do you say, sticking a needle into your body and pumping so much of insulin, and in spite of that wanting to. But what is the care that's coming in? Is there a possibility that in the future diabetes could be really cured by medication alone?
No, there are a lot of medication which are really solving the problem. Like I think many would have heard about GLP-1 analogs. They are very expensive medications in India. I don't think we can, at this point, even in our country, many people can afford the medicine. But in maybe 15 years' time, GLP-1 analogs will become mainstream actually. So what they do is they reduce your weight, reduce your appetite also. So the main problem what we have is that whenever we cut down, like I told, you need to run 1 hour and do a diet, etc. Once you start doing that, once you reduce weight, the body asks you to eat more actually. Because the moment you reduce 5 kg weight, the body tells you eat more, eat more, eat
But
more.
there are a lot of quacks on YouTube particularly who keep talking about all kinds of things about diabetes. And that's what is very interesting because they actually offer a better life in terms of you can eat anything, you can do anything, but you have to take
don't
insulin.
believe anybody who says that you must change your lifestyle if you have diabetes. There's no doubt about it. In addition to that, I don't mind if patients come to me and they are taking Ayurvedic or homeopathy medicines.
Not just that, people say that, just with your diet you can completely reverse diabetes. And many people say that it's impossible to reverse diabetes once you get it. You can only manage it. What is your opinion?
No, reversal of diabetes does happen if you do a very significant
But does it
diet.
stay that way?
No, it doesn't stay that way forever actually, because forever is a long time. So there are trials which are looked at 5 years remission, 10 years remission.
It's happened.
Yeah, it's happened. There is something called a direct trial which is done in UK. So where they are given a short duration, severe diet. It's a 800 calorie diet. So 800 calorie diet is what you will eat in Rajdhani in a single meal. Probably a Rajdhani meal is more than that, 1000 calories maybe. And 800 calories is what you will eat the whole day actually. So it causes extreme or a rapid weight loss. And this has been done in general practice patients in UK. And it causes remission in a good 80% of patients. Remission means you stop all the medication for 6 months, not for 1 day, 2 day, 6 months duration. And after that, when you stop the medication and if you don't take any treatment, it stays that way in a large number of patients. And whoever lost weight for a long time, whoever lost more amount of weight and kept it off for a longer duration of time, tend to do well and not get it back actually. Okay.
I have seen that in some cases, even this water diet seems to have worked for some people in also keeping the levels low after they've stopped the diet too.
Water diet means starvation basically.
Starvation, but just on water, just for about 3 days, 5 days.
Yeah, it works. No. Acute fasting works very well for diabetes actually.
So do you think the treatment now has to be more like a combination of many things and not just
it's not just medication alone. Even in my practice, so all my patients get very significant diet and exercise advice actually. So without diet and exercise, I think without focusing on that, just giving medication alone is not good in the long run actually. But we need to educate the patient saying that everything is important. So even in this trial which I spoke about, only 80% went into remission. What about the remaining 20%?
Yeah.
So these are people who have taken 800 calories and did a fast, and after that still had diabetes at the end of literally ate nothing for 6 weeks.
That perhaps is the most, and perhaps one of the last questions is that diabetes unfortunately is only associated with the crystalline sugar. but not about anything else that could actually, aggravate it. For instance, they say one potato has about 15 teaspoons, is equal to 15 teaspoons of sugar. But a lot of people eat everything else, but only avoid
Avoid the
sugar.
No, it's got to do with,
You got
it has
it,
to,
but
it has got to do with
then-
the total carbohydrate intake,
Yeah,
not really.
But to be able to even identify carbohydrates, because you eat more protein, that's wrong for something else. You eat more of this thing, that's something else.
In India, it's very difficult for
If you
patients to
eat-
identify because
if you
almost
eat-
all what they eat is carbohydrate.
If you eat nothing, you have constipation. That means that you have to keep going to a doctor for some reason or the other throughout your life, because you have millions of doctors, I'm sure. In a few years, you'll have so many doctors than perhaps of any other profession in the country. So, do you think that, there could be an aversion to medication in a while, if at all, you pump in so much. Sometimes it's generic, sometimes it's branded medication. Sometimes the medicine works, sometimes the medicine doesn't. Like I've seen with one medicine for neuropathic pain. One medicine doesn't work at all, but the branded one works. And most people can't even afford that, but they keep taking it. And one day they may just quit because saying that after all, what?
It's not working.
Correct or not? Because everybody can't afford the kind of medication.
Yeah. So the thing is, the number of medication, what you treat, I think you need to have as a patient or this thing. So whenever you talk to a doctor, so even I have been patient several times. So we need to discuss honestly with the doctor what is the risk and benefit with the medication. So what is it that I expect to gain by taking this? That's the first question you need to ask. And I think most qualified doctors who are able to prescribe that medicine confidently should be able to tell you that actually. So what's the kind of benefit you will get and what is the risk that is there?
Another thing ultimately is that a diabetologist having to keep his health so good that he should never get diabetes. Maybe that's the worst thing.
I don't
because
think-
even like when you're talking to other people about diet and obesity, and if you yourself are putting on weight, the first thing people watch is if you could not control your weight. Are you telling me I can?
No. Let me be honest. I have hypertension from the age of 30. And I have diabetes for the last 1 or 2 years. I am well treated on medication and diet and exercise. So it's not uncommon to get these diseases. These are very common diseases. And what is good for the goose is good for the gander. Okay. So as long as you're a human, unless I'm an alien, I cannot defy the probability logic.
But you keep saying something. More than the medication, more than the treatment, more than anything else, it is also like watching your sugar level.
Yeah. Watching the sugar, HbA1c has to be monitored from time to time. You need to do your diet and exercise. And it's not like you brought up the point that, people are scaremongering about diabetes. Diabetes is this, bada chada ke batao, it's a big thing and all. It's not such a big thing. I mean, the majority of patients, if they follow a systematic plan of treatment, they do very well. And it's as though they don't have the disease at all. And I have patients, who come to me with 40, 45 years of diabetes actually. They got the diabetes the year before I was born sometimes.
But how
they're doing well.
But how does it make you feel when you have the satisfaction of having actually treated so many people and many people seeing a lot of progress?
Yeah, it's very
And
satisfying.
why do you think it's been happening? Because there are doctors and hospitals people have been going to, and things sometimes remain the same or sometimes they just worsen. But is there something else that you do?
I would not say that I do
I've
anything
seen it
extraordinary.
myself. No, I've seen it myself. I've seen it myself with a lot of people that you seem to have developed a technique or some magic that you
There is no magic. It's only common sense. That's all.
but you seem to have shown extraordinary results with your patients.
No, it's common sense only. So
Is it also because you understand the other things also? You just don't look at diabetes in isolation.
Yeah. You should never look at it in a silo, actually. So a person, in fact, I had a patient once coming into me who said that, treated by another expert in the field, an endocrinologist only, that, sir, ಈ ಡಾಕ್ಟರ್ ನನಗೆ ನನ್ನ ಡಯಾಬಿಟಿಸ್ ಮಾತ್ರ ಇರೋ ಥರ ಎಲ್ಲ ಮೆಡಿಸಿನ್ಸು ಬರ್ಕೊಟ್ಟಿದ್ದಾರೆ, ನನಗೆ ಬಾಕಿ ಕಾಯಿಲೆನೂ ಇದೆ. He's an elderly gentleman, 75, 76 years of age. So he has a cardiac problem, he has a lung problem, he has a diabetes problem. His diabetes treatment is so complex that he's not able to cope with it actually. So that's a genuine feeling that people get. And while specialization is important, it's important to understand how complex the patient's life is actually. The patient's lives can be very, very complicated. Some people don't have any time to do any exercise. See, if somebody says that I'm working for 20 hours a day and I'm on this thing, and he's completely, about to cry. So there's no point in telling him that you run for 20 minutes a day and go to the gym, join gym tomorrow like that. So we need to take time actually. So that's where the empathy comes in. That's where, common sense comes in. When to say what and when and how to whom.
You seem to be liking the fact that you're a doctor.
Oh, I do like it. Yeah.
Why?
Because, see, I would say that part of it is due to, it's like I would say a doctor's job is a blue collar job. It is not a white collar job. It is not something that you do behind this thing. So I would, like for example, if you've done the interiors of your house, calling the head carpenter, he'll come and he'll tell you how to fix this properly. I mean, when you put this shelf up, he can look up the things and he'll tell you what can go wrong, how to fit this thing. So over a period of time, I've achieved fairly decent ability to do this thing. So it's not that you fit the shelf properly. The malkin of the house should be happy with the way the house. You should give the effect.
It's not
That's
just
more
to
important.
your satisfaction, it's also
It's to the customer's satisfaction. So
also
once
to
you
the
reach
liking.
that expertise, then you start liking it actually. But reaching that expertise takes time. I mean, it is not easy.
But finally, the question is that, of course, you smile a lot and you sound jovial and you also are happy. Whether you are actually or not, that doesn't matter. But when people look at you, that they get this perception that, of course, that you think positively. But that's generally of doctors these days who are successful. People who can communicate well, people who can smile a lot, people who can connect to the patients on, even if it's not real, but they feel that it's one-on-one. They feel that you care.
No, that's true. See, unless you yourself are happy in your skin, it's very difficult to, convey that warmth to the patient actually. So at the end of the day, we should be happy with what we do. So, if you're always unhappy, this is not worked out for me in life. That is not worked out for me in life. That's not the way to be actually. So, so once you harbor those things, it's very difficult to convey that warmth actually. So, I mean, at some level, we need to be happy with what we have achieved. There are limitations. I mean, after a certain duration in life, when you start off, you think that you can do everything. Then later on, you realize that there are some limitations to what we can do. But within those limitations, you deliver some result and you see that patients are getting the results. It's very, very satisfying then actually. At least you've made some change. At least you've brought something to the table.
Thank you, Dr. Anantharaman. It was a pleasure speaking and also learning a lot. But at the same time, it doesn't look very hopeful for diabetic patients, because ultimately it's also once again about medicine and diet and exercise. I thought you would say something that there is going to be something else.
Let me be philosophical. No, see, once you're born in this life, it's a limited overs game. So this is what I tell my patients actually. So you're not going to live forever. So only thing is we need to play until the last ball. That's all.
Okay. Thank you.
So we should not get bowled out like what our Indian cricket team did recently. Last two balls, they made sure they played until the last ball.
Thank you very much.
Okay, sure.